we will talk about sperm retrieval techniques. Sperm retrieval techniques are techniques which involve identification, isolation, and suspension of spermatozoa obtained from urogenital tract other than the ejaculate. What are the indications for these sperm retrievals? Non-obstructive azoospermia, obstructive azoospermia, aspermia, or anejaculation, as we have discussed already in our previous video, when the other methods like PVS and electroejaculation, they are not successful. Then fourthly, for the fertility preservation in peripubertal boys. Fifthly, there is onco-TC, when the oncological surgeries are done for some cancers of the testicular tissue. That time some amount of testicular tissue is preserved for the sperm retrieval, so that is known as onco-TC. What are the contraindications for the same, for sperm retrieval? If patient has hypogonadotropic hypogonadism, then the medical management should be the one which should be tried first, and sperm retrieval is contraindicated. What are the prerequisites before taking up the patient for surgical sperm retrieval? Firstly, we must see the semen volume and pH, because we need to rule out the obstructive and non-obstructive azoospermia, because the different sperm retrieval methods are applied if the causes are different, and ruling out retrograde ejaculation is very important. Secondly, examination must be done for any testicular masses, any the fluid collection around the testis, and and then the hormonal analysis is very important, which is the FSH and testosterone. Why? Because usually the sperm retrieval, the success of sperm retrieval depends on what the FSH and testosterone is. If FSH is very high, thus it is very unlikely to retrieve the sperms and to get the sperms, and the counseling of the patient is done accordingly. And obviously we must rule out hypogonadotropic hypogonadism, which is possible only by doing the FSH and testosterone. Then we must do the karyotyping and Y chromosome microdeletions, because as we can see from this table, in azoospermia factor A and B absence, the success of sperm retrieval is 0%. But if in absence of azoospermia factor C, still the success of sperm retrieval is around 50 to 70%. So if patient has absence of azoospermia factor A and B, we must not subject the patient to sperm retrieval. What are the different sperm retrieval procedures? First is we have to see from where we are doing the sperm retrieval. There are two methods. It can be done percutaneously or open methods. If we are retrieving the sperm from epididymis, that is known as percutaneous epididymal sperm aspiration. But if open methods are followed, then it is micro or microsurgical epididymal sperm aspiration. We can retrieve the sperms from vas deferens also, which is known as basal sperm aspiration, which is usually an open method. Then finally, the sperms, when they are retrieved from testes, if it is open, then it is TC, and if it is percutaneous, it is testicular sperm aspiration. Difference between testicular sperm aspiration and TC is an open method where the testicular sperm extraction is done, which can be done with the microscope also. When it is done with microscope, it is known as micro TC. Now we will be discussing all these methods one by one. First one is the percutaneous epididymal sperm aspiration. It is usually done in the patients with the obstructive azoospermia. As we can see in the image, the epididymis is held between the index finger and the thumb, and we can see here the butterfly needle is put in the epididymis blindly, and then the aspiration is being done. So it is because of the negative pressure, the aspirate from the epididymis, it comes into the tuberculin syringe. Then coming on to the microsurgical epididymal sperm aspiration, the indication is obstructive azoospermia. In this method, the scrotum is opened by a longitudinal incision, and then the contents of the epididymis are aspirated. Then the basal sperm aspiration, it is done prior to or during the vasectomy reversal. Simply a 5 mm incision made on the anterior surface of the vas, and then the contents are aspirated. And the incision on the vas, it is closed by a single stitch. Testicular methods, it can be testicular sperm aspiration, testicular sperm extraction, and micro TC. Firstly, testicular sperm aspiration, which is also known as FNSE, it is a simple and non-invasive, less invasive technique. So it is simply either the local anesthesia is given, or even without anesthesia it can be done, and it is suitable for obstructive azoospermia patients when the epididymis is not able to give the sperms or the expertise is not there. In testicular sperm extraction, this is done in the patients with non-obstructive azoospermia, and it gives better yield of sperm as compared to testicular sperm aspiration. It can be done by open or microscopic approach. We can see here in the open method, the scrotal incision is given in the first image and scrotal layers are open, and we can see that white tissue, which is the tunica albuginea, and protruding testicular tissue can be seen in the image, and then the incision is closed in layers. The good point with testicular sperm extraction is we get good amount of tissue, unlike with TISA. But the disadvantage is the testicular atrophy can happen at multiple biopsy sites. Then coming on to micro TC, it is a method of choice for non-obstructive azoospermia, and it needs an operative microscope guidance. This is a method in which the micro TC is done. We can see here the microscopes and how the surgeons are standing. And we can see here in the image D, the testicular parenchyma is dissected at the 16 to 20x magnification, and at magnification the seminiferous tubules are very clearly visible. The one which are more plump and more distended are taken up for aspiration, and they are extracted and they are looked under the microscope, because the one which are plump and more reddish in color, they are more likely to yield the sperm. And later on the testis is closed in layers. So this is what the different procedures for the testicular for the sperm retrieval are, and we will be coming on with more videos on the male infertility, and so please like and subscribe, and thank you for your patient listening.